Malaria. You see, this disease, malaria, it's actually an insane disease, and it has had the biggest impact in human history. In fact, right from the fact when the cause was not even known, because malaria is an Italian name from mal, meaning bad, and area, meaning air. So then they even thought that it was bad air that was causing malaria. Up to the 1600s, when the synchronity, I mean, for quinine that was used in the treatment of malaria, up to the early 1900s, when the US was ravaged by this insane disease. In fact, in the early 1900s, the United States declared sort of like a state of emergency on malaria. They decided to slaughter and kill all the mosquitoes in their region. In fact, they took it head on, killed all the mosquitoes, and then by 1951, US was certified malaria free. North America and Europe followed the same trend. They eliminated all the mosquitoes in their region, and so they were turned malaria free. But then this particular disease is still a global trend and has a global impact, especially in developing countries like us. Since the developed countries have gone and did this, of course, it's something that we can employ, but due to a lot of factors like the weather, the socioeconomic problems, the scarce economic resources, and that lack of strong will by African leaders to take care of this. And it's really a global body, specifically in Africa. In fact, do you know that in 2023, the World Health Organization recorded over 263 cases of malaria? Over 263 million people were affected by malaria. And among these 263 million people, 94% of them were in Africa. 94% too. And in 2023 also, according to the WHO, more than 500,000 people died. Just over 500,000 people died of malaria. And among these 500,000 people, take note, 95, 95% of those that died worldwide were in Africa. And among those 95% of people that died, it is devastating to know that 76% of them are children barely below the age of 5 years. So you see, it's actually a big burden and it's something we need to look into. And you see, Nigeria being the giant of Africa that it is, it's definitely going to take the giant share of it. And I'm sure there are even more cases than that because in Nigeria and in some other African countries, we have poor data collection. We have poor data local collection. So I'm sure there are some cases that in some villages, understand, that is not even recorded. So it's a really huge burden. And because of that, we need to continuously educate ourselves and enlighten ourselves regarding what malaria is, some of the ways to prevent it, and what we need to do to make sure we are we become part of those countries that we are free from this ancient disease. So now, talking about how malaria is transmitted, it's something of a general knowledge because malaria is endemic in Nigeria. Endemic meaning it occurs periodically. So, talking about the transmission, it is of course transmitted by the devil that we all know, the female Anopheles mosquito. That small tiny thing. I don't know how something can be so small, can be so slicky, so persistent, so adaptive. In fact, I think it's one of the most dangerous predators on this earth actually. So what happens generally is if it takes a blood meal from an infected person, it injects the parasite from the person's blood. So it takes the parasite from the person's blood, and once it goes to take a blood meal from someone that is not infected, from taking a blood meal from an uninfected person, it injects the parasite into the person. And before you know, within 10 to 15 days, the person develops symptoms. Some patients will come to a doctor's cubicle and they'll say, doctor, I think I'm feeling headache, even though the headache is not really that much. I don't know. I don't think I have fever. I'm just feeling weak. And I know it's because of that mosquito that bit me 3 days ago. I didn't sleep under net. It bit me. It's not possible that it's mosquito. If really you were not bitten by mosquito until 3 days ago, it's not possible that it is malaria. You understand? So once you get infected by this parasite through this mosquito, it takes 10 to 15 days for you to develop symptoms. And the symptoms, even though I'm a doctor, I'm sure if they call you that are not a doctor, and they ask us a question now, okay, what are the symptoms of malaria? If they ask me to name two symptoms of malaria, I'm sure you would have named like 10 before I'm able to name 3. Why? Because it's general knowledge, so to say. But I want to divide these symptoms classically into two. Because there are those that they have the mild cases and then those with severe cases. For the mild cases, it usually occurs in people like me and adults. We are relatively healthy, and now we've had malaria in the past. In a year, for sometimes we experience malaria like twice, thrice. So we've developed some form of immunity, some form of partial immunity to malaria. So when it comes, generally what we feel is headache, fever, chills, sometimes some body pain. Some people used to complain that they used to have bitter taste. Me and I used to have bitter taste. So if you used to have bitter taste, comment say something in the comment section. And if there's any other thing you feel like you used to feel when you have malaria, because some patients will come and say, Doctor, I'm feeling somehow. And sometimes that somehow, I don't even know what it means. So if you understand your somehow, and usually after that you were tested, you were positive, you were treated, and you got cured, please say it in the comment section how you feel. So generally for the mild cases, how you felt. So generally for the mild cases, usually they have fever, some chills, some general body pain, some muscle cramps, and some weakness. Usually those, once you are tested and you're positive, you are given tablets, anti-malaria, and then you are cured. But for the severe cases, this one is the most serious one, honestly. And if not tackled early, death can ensue within 12 to 24 hours. So usually it's common amongst children under 5, usually from 6 months to below 5 years. That's one. Secondly, it is common among pregnant women. Then also among immunocompromised people, especially with people with HIV and AIDS, and then they are not taking their antiretroviral well. And also in diabetes mellitus patients, uncontrolled diabetes mellitus. So severe malaria can occur in this set of individuals. And usually when it's severe, it can affect basically any system. Can affect the brain, it can lead to multiple convulsions in children. You see your child convulsing, can lead to coma, can affect the chest, causing difficulty in breathing, can affect the liver, where the patient presents with yellowish eye, can affect the kidney, can cause acute kidney injury, can cause an acute kidney injury. But some people, their urine turn black, or Coca-Cola black. So it's really a severe, it's really a severe form of malaria. And usually you can also find this in travelers that came from the Europe and North America, US. Those ones, they are not usually affected by malaria, but so when they come here, they experience severe symptoms. So now going to the prevention, because they say prevention is better than cure. How do you prevent malaria? Since we've understood that it's really a burden, it's affecting our young ones, it's affecting our pregnant women, we need to take proactive measures as individuals, and then the government has also put in some particular measures that they've been doing for years now. As individuals, the preventive measures are what we've been told continuously. They are what we've been told repeatedly. So insecticide treated nets. If you have a child that is under 5 years of age and your wife is pregnant, or you're a pregnant woman, or you are at risk of being immunocompromised, and you're in an area that mosquitoes are quite prevalent. And there are some areas, if you see there are mosquitoes, let me just keep quiet and not mention some areas here. So if you're in those areas, you should try as much as possible to be sleeping under an insecticide treated net. You should not have a child that is above 6 months or generally below 5 years, and the child is not sleeping under it. In fact, if you are among the few people that react to the insecticide treated net, try to get a net at least to serve as a physical barrier. You should also spray your rooms with mosquito sprays. Spray your rooms. You can use coil. Its work and is effective. Next is you can also use mosquito lubricants, mosquito repellents. You can find them in some pharmacy. Then you should also make sure that your surrounding is tidied up and clean. There should be no stagnant water because that's what mosquitoes breed. That's where mosquitoes breed. There should be no stagnant water. You should try to clear bushes around your surrounding. Keep the environment clean. All these measures, in fact, will not only protect you against mosquito, it will protect you against the communicable diseases that is ravaging us in Africa and especially here in Nigeria. Then, as government have been trying to understand put in some programs for years now. There are a lot of like the National Malaria Elimination Program, you understand the End Malaria Strategy, so many programs. But due to some certain factors and complexities, of course, like poor data collection, you understand this poor zeal in eliminating malaria, also poor data collection. Poor data collection has led to poor implementation of some of these policies, or even total abandonment of it. Even though they've really made a lot of effort towards, you know, sharing these mosquito nets, also especially this intermittent preventive therapy for pregnant women. If you're a pregnant woman and you're above 16 weeks, and if not taking chemoprophylaxis for malaria, you're on your own. And that most likely means you've not started antenatal safe. You're on your own. On a more brighter note, along with other interventions that the Nigeria government has put in place in order to eliminate malaria from Nigeria, especially the administration of the nets, the treated nets, also the chemoprophylaxis for pregnant women, the residual home spraying, they have rolled in malaria vaccine to Nigeria. As at December last year, 2024, vaccines were introduced into the country. It's now present in two states. And I plan to make a short video on it, detailing some of the most important things about the vaccine. Because it's usually given to children from 5 months to 12 to 24 months of age. And it prevents transmission of malaria from one person to another. And hopefully we'll get to a point where, especially these young generations, when they come up, where Nigeria is actually free from this ancient disease. So it really go a long way. This person will really go a long way for us here in Nigeria and also in Africa in general. So hopefully you've learned one or two things from this video. If you have, like, subscribe, and make some comments in the comment section. And tell us some of the preventive measures you've put in place that has prevented you and your children from, getting malaria routinely like some people do. So with this, I said thank you and see you in the next video. Bye bye.